Welcome to Wonder Hair Career Institute Online. My name is Livina and I'll be your instructor for today. And today we are going to talk about transferring a patient from bed into a wheelchair using a pivot technique and a transfer belt or gait belt. A transfer is an act of moving something or someone to another place. Pivot technique is useful for patients who can support most of their weight by standing but are too weak to take steps to move from one place to another. A gait belt is an assistive device which can be used to help safely transfer a patient or a person from a bed to a wheelchair, assist with sitting and standing, and help with walking around. Gait belt protects the care recipient from falling and also protect the caregiver from injuring his or her back as they lift or move the care recipients. On the day of your exam, the instruction will read like this. You are asked to transfer a resident who is lying in bed into a wheelchair. A pivot transfer technique is required and a gait belt is required. The resident is able to stand but cannot take steps. The role of this patient will be one of the students on that day. If we go down to the checklist on number 3, it says place wheelchair near resident's bed before assisting resident to sit at the edge of the bed. Move wheelchair footrest out of the way before standing resident for transfer. Place non-skid footwear on resident before standing resident. Provide support to assist resident to sitting position on side of bed without pulling resident by lower arms or hand. Provide resident opportunity to sit on side of bed to adjust to change in position before beginning transfer. Position resident feet flat on the floor before standing to begin transfer. Prepare for transfer by positioning wheelchair with front interior wheel close enough to bed so that transfer can be completed as a pivot. Lock wheelchair before standing resident to begin transfer. Apply transfer belt before standing resident, placing around the resident waist and over clothing. Secured so that only flat fingers, hand, feet under belt, and the belt does not catch skin or skin folds. Provide cue or signal to resident before assisting to stand. Stand in front of resident, reaching under resident arm to hold transfer belt at sides or around back throughout transfer. Brace one or both resident legs during transfer while assisting to stand, turn, and sit. Maintain own body meekness when assisting resident to stand, turn, and sit. Transfer resident as a pivot completed without having resident take step to reach wheelchair, and before assisting resident to sit in wheelchair position with the back of resident leg against the seat of the wheelchair. Support resident to provide for controlled gentle lowering into seat of wheelchair. Leave resident position in wheelchair in proper body alignment, hip against back of seat and feet on footrest. Remove transfer belt from resident waist without harming residents. When you are about to transfer your patient, you have to let that person sit at the edge of the bed for a few seconds or even a minute. This is called dangling. You are preventing what is called orthostatic hypotension. This is low blood pressure due to what? changing in position. That's why you have to let this patient sit at the edge of bed for a few seconds. Another critical point here is that you will make sure this patient is wearing non-skid shoe before you transfer. One other thing here that is mentioned in this skill is pivot technique, and we mentioned earlier that this person can support most of her weight by standing but cannot take step. So when you get your patient to transfer, you don't want this patient to take step before he or she sit on that wheelchair. When the person sits on the wheelchair, you want to make sure the hip is rightly against the wheelchair. You want to make sure that this patient's leg is what? Placed on footrest. Remember your gait belt. Your gait belt should be placed correctly. We've talked about gait belt when we're dealing with ambulation. You want to take into consideration about the skin folds. You want to make sure that your patient is comfortable. Remember pivot technique. The person must not take step before he or she sits on the wheelchair. Dangling, the person must sit at the edge of the bed for a few seconds to avoid what? Dizziness. Let's take few questions. Which muscles are injured most often when a nursing assistant does not use proper body mechanism? Leg muscles, neck muscles, shoulder muscles, or back muscles? The answer is back muscles. Most people in healthcare have back injuries due to what? Poor body mechanism. When helping to lift a resident up in bed, which of the following positions demonstrate proper use of body mechanism? Keep your back and knees straight and lift using your thigh muscles. B. Bend slightly at the waist. Keep knees partially flexed and lift with your leg muscles. Bend slightly at the waist. Keep knees partially flexed and lift with your back muscles. Or use whatever position and muscle make you feel more comfortable. The answer is B. Bend slightly at the waist. Keep knees partially flexed and lift with your leg muscles. You might see it as your thigh muscles. You don't lift with your back muscles. When preparing to safely transfer a patient from bed to wheelchair using a transfer belt, the nurse aide will do what first? When you are asked to go and transfer a patient, maybe you don't know this patient too well, the first thing you need to do is to assess that patient, the capability of that person to transfer. Which instruction will the nurse give a patient who is able to assist with transfer for a bed to a wheelchair using a transfer belt? When you're about to transfer your patient, most times people say, okay, put your hands on my shoulder. At the count of 3, they will get up. You can tell the patient, you can push down on the mattress with both hands and stand when I count 1, 2, 3. A patient lying supine in bed is being transferred to a wheelchair using a transfer belt. Which action would the nurse perform just before moving the patient to the side of the bed? Depending on the technique you are using. If somebody is lying supine, you want to raise that head of the bed at least 30 degrees before you move that person to the side. The nurse is preparing to transfer a patient with left-sided weakness from the bed to a wheelchair using a transfer belt. Which position would the nurse instruct the patient to assume? Place your stronger leg forward and your weaker leg towards the back. If you are going to transfer a patient with right-sided weakness, where will you place the wheelchair? Weak side or the strong side? On the strong side. Why you help from the weaker side? Before helping a resident to stand who has been lying in bed, the nurse aide needs to allow time for the resident to adjust to sitting at the edge of the bed. And what is that called? Dangling. Allow that person to sit at the edge of the bed for a little while before you transfer, and that is called dangling. Thanks for watching. I hope you enjoy the lecture. If you do, please subscribe and hit the notification button. Thank you and good luck in your exams.